Hello, my name's Bronwyn Cooper. I'm a podiatrist who happens to retrain nearly every patient I see in how to walk correctly, simply because virtually every person coming into my clinic or to our footwear outlet with chronic problems are walking poorly. They've got an inefficient gait technique that's actually having a harmful effect on their clinical problems. And if they've got poor gait and poor posture like this skeleton here on the left, many people assume, and many health professionals assume, that that's probably the result of their problem, but in fact it can also be the cause, and in some instances definitely the cause and not the effect of the problem. So what am I talking about? I'm talking about a trend that's well recognised in running. It's referred to as barefoot running, and any barefoot runners looking at this right now, people who run with a barefoot natural technique as to how they would run if they literally didn't have shoes on, would recognise that the other skeleton on the right is a more upright, centred trunk, a more centred stance or shorter stride length. It's more around the technique that's referred to as natural or correct running or barefoot running. But the same applies to walking, and after all, we all walk before we can run, and indeed there are a lot of people that can't even walk because of their pain, let alone run. So what I wanted to cover today, a couple of very simple fundamentals that will allow clinicians to really identify some of the destructive problems with their patient's gait that could be the real reason on why these people's symptoms are not getting better. Because without rectifying their faulty gait parameters, what you're going to find is their symptoms can get better for a period of time, but over long periods of time their underlying conditions don't, their posture doesn't, their movement parameters don't, and their ability just to even get out and do everyday pain-free walking is very much compromised. We're not just talking about young people, but we're talking about age groups from kids right through to the frail-aged. So, correct walking technique largely involves 3 or 4 things. The centred posture I've alluded to, the shorter stride is going to put less stress at heel, it's going to put less stress at ball of foot, knees, all of the other weight-bearing joints. Now, you can look at these sort of things, but the thing that we haven't been teaching our clinicians to do enough of is to listen to patients' gait. And if you listen to their foot strike when they're in shoes, you may not hear a poor, faulty foot strike that they will manifest if they have it when they're walking barefooted. So I would urge you all to listen and look at your patients walking barefoot, and it can be on a carpeted floor, and listen for a very heavy, banging, destructive, highly impactful foot strike. Now, in running, you want to know whether it's midfoot or forefoot, but in walking, it's nearly always heel strike. Now, if it's a nice quieter heel strike or foot strike, and frequently it'll be a more frequent number of strides per minute, or cadence as it's called in running, you'll actually find that that is a far less destructive one. So if you're able to hear this sort of impact force, that needs to be changed, and it needs to be changed immediately, and it can be very easily done. Now, how do we do that? Number one, you then need to alert the patient to what they're hearing, and then you want to ask them to basically repeat the same exercise of walking and only change one thing, and that is simply to get them to try to land lighter, because if they pretend they're going to sneak up on their best friend and surprise them, they will be able to walk more quietly. Now, you've alerted them to that, do your examination, carry out your treatment, and if they really have these faulty gait patterns, then you definitely need to do something about it. Now, if you have the luxury of being able to provide some different proprioceptive input under the foot, the sensory nerves in the sole of the foot are going to be sending a lot more information and different signals to the brain than when that person walked in with their own shoes on. Now, some of you will have Pilates mats or balance beam type mats in your clinics. You can get the patient to walk up and down on that. That'll just scramble pain messages to the brain and reset their proprioceptive input a little bit. If you have different shoes, particularly one with less support, less structure, less motion control, less excessive cushioning and less heel elevation, you will definitely find it's easy to retrain your patients in how they walk. Another very simple and time-effective and cost-effective way of doing it is to actually put a proprioceptive stimulating insole system, such as the Barefoot Science, into their shoe and have them walk up and down again, because it is much easier to get that same patient to concentrate on their improved upright stance, centralised posture, shorter stride and softer landings if they've got that different apparatus underneath their feet. Now, I'll talk a bit more about this in subsequent videos about the influence of shoes on gait. I'll also talk at length on how easy the Barefoot Science is to use. But in the meantime, I hope this one simple clinical tool will help you all in your practices to be able to implement this to help your patients achieve better pain-free walking and to get out there and exercise and enjoy life. Thank you.